comes in.
Saves a lot of time for the physicians. You have everything ready when they go in the room. They just basically go in and do the exam.
After the exam, a medical assistant will go over any testing, lab work, diagnostics, or medication the doctor has ordered.
Medical assistants do injections, whether it's pediatric immunizations, we might do shingles vaccines, any kind of vaccines that are needed, flu shots, pneumonia shots.
Medical assistants need to pass a state exam to be certified, a rewarding career with many responsibilities. For Lee Health, I'm Lindsay Morton.
Hey, get your blood pressure, you can roll your sleeve up for me. You get a rapport with the patients, and they trust you. The longer you're in an office, the patients feel very comfortable with the MA and they trust them.
Her love for her patients. It's what medical assistant Stephanie Wysong says she enjoys most about her job.
It's been a good place to work. Obviously, 17 years later.
She found her passion as a medical assistant, a job that was supposed to get her foot in the door. After 17 years, she says the patients and many job requirements are what made her stay.
I just found that I really enjoyed what I was doing. So I stuck with it.
Medical assistants escort patients back to the room, take vital signs, do in-office procedures, and then discharge the patient after they meet with the physician.
We actually work very closely with the physician, anything they need. Like I said, any kind of testing that's done in the office, if they need assistance in the room with the patient when they're doing an exam, we do that. Paperwork, pretty much anything they need.
The medical assistant will address any health concerns with the patient before the physician comes in.
Saves a lot of time for the physicians. You have everything ready when they go in the room. They just basically go in and do the exam.
After the exam, a medical assistant will go over any testing, lab work, diagnostics, or medication the doctor has ordered.
Medical assistants do injections, whether it's pediatric immunizations, we might do shingles vaccines, any kind of vaccines that are needed, flu shots, pneumonia shots.
Medical assistants need to pass a state exam to be certified, a rewarding career with many responsibilities. For Lee Health, I'm Lindsay Morton.
Hi, I'm Leslie Haviland. I'm the Director of Student Services, and I want to welcome you guys all today to our talk about medical assisting in medical administrative billing and coding. And we're really excited to have you guys. I do want to let you guys know if you have any questions during the session, all you need to do is just go ahead and post your questions in the chat, and I'm going to tell you a little bit about the format. You're going to meet a lot of folks today from our campus. First is Director of Admissions Ron Lewis, our Dean of Students, Cassandra Reed. You're going to meet one of our professors, Professor Lisa Stivers, and you're also going to meet one of our awesome students, Jacob Oakley. So with that, I'll let Ron take the lead here.
Thank you, Leslie, and welcome everyone. My name is Ron Lewis. As she mentioned, I'm the Director of Admissions for the Port St. Lucie campus, and I'd like to provide you with some history and background of our university. Kaiser University was founded in 1977 by Dr. Arthur Kaiser and his mother, Evelyn Kaiser. They started with one program, one student, and a simple philosophy: students first. They were able to start with one student due to a unique curriculum featuring one class, 1 month at a time. This wheel curriculum structure allows new students to join programs during 12 different start dates throughout the year. This unique approach to education continues today in the majority of our educational programs. Today, Kaiser University is a not-for-profit, level 6, regionally accredited university, offering over 100 degree programs from the associate to doctoral level. We deliver these programs on campus, online, or in a hybrid format, which is a combination of both. We have more than 20 campuses throughout Florida in most of the major population centers, including our more traditional flagship campus in West Palm Beach, where we have more than 20 sports teams. And together, we are Seahawk Nation. Our objective at Kaiser University is to provide career-focused education and degrees that are in demand in our communities that lead to solid career opportunities. Our presentation today will outline our medical assisting and medical administrative billing and coding associate degree programs. But first, here to tell you more about our educational philosophy, I'd like to introduce you to our Dean of Academics, Mrs. Cassandra Reed. Dean Reed.
Hello, everyone. Here at Kaiser, Port St. Lucie campus, we have amazing faculty members here to provide the tools and the resources for you to be successful in the program that you're pursuing. Our faculty members are committed to the value and the mission of the university, and students are our #1 priority. The faculty members here at this campus have years of experience in the professional field and are excited to share their knowledge and expertise with all KU students. At this time, I would like to introduce to you Mrs. Stivers. She is the Program Director for Medical Assisting.
Thank you, Dean Reed. Hi, good afternoon, everybody. Hope everyone is enjoying their day, and I'm glad you could join us this afternoon. As Dean Reed mentioned, my name is Lisa Stivers, and I am the Program Director and Instructor for the Medical Assisting Department, and I also oversee the Medical Administrative Medical Coding and Billing program. I'm going to tell you a little bit about both of those programs today, and we'll start with a medical assisting. But first, before I go any further, I would like to remind you that you can text any comment or question in the chat room below, and we will monitor them throughout the session, so please feel free to ask any questions. Before I get started, I'd like to tell you a little bit about my career and my experience, and then I'll tell you a little bit about the programs, just so you know a little bit about my education and my experience. Prior to working as an instructor, I worked as a registered medical assistant in the field for 15 years. I worked in several specialties, including family practice, internal medicine, which is a little bit of family practice, cardiology, chiropractic, orthopedics, obstetrics, gynecology, and my specialty was pediatrics. And I did that for 15 years. Then I answered an ad. It was actually a blind ad as an instructor, and I fell in love with what I did, and I've been doing it ever since. This year, I celebrate 13 years with Kaiser University as a certified allied health instructor, and I love every minute of it. So let's get started. I'll tell you a little bit about what I do and what you would expect to do as a medical assistant student. The video was an excellent video. It did tell you a lot about the skills, and I'll tell you a little bit about the school and what you can expect. So we run as a hybrid program here, and Ron Lewis mentioned a little bit about that. And basically what that means is here at Kaiser, our program is a hybrid format, meaning we combine face-to-face classroom instruction with computerized-based learning. And that allows our students to be flexible with their learning, their work, and anything else that they might have going at home. And it also allows the students and the instructor to really concentrate on skill-based skills and competencies within the classroom and prepare you for that career that you're here to do. Medical assisting is a very interesting, very multi-skilled practice. And as you can see, there's a lot of opportunities as I went about myself when I worked in the field. So it's a very fast-paced, fun, and exciting allied health field. Here we have an externship that we do at the end of the program. It's 2 months long, where we work alongside of other medical assistants, nurses, nurse practitioners, PAs, which are physician's assistants, and doctors, and we get that real life experience. What's very exciting here in my program at Kaiser University in the Port St. Lucie campus is a majority of my students end up getting hired or offered a job on their externship. That's a majority of them. That's pretty cool. It's exciting. It's exciting for the students. So that is kudos to my students for working so hard and loving what they do, and our sites are really pleased with them, and we're happy for that. Many times they'll go into a larger office and they will work alongside of students that were once my students and that are now working as employees, and they take them underneath their wing and mentor them, which is great. We also have a state exam that you have to take. It's the Registered Medical Assisting Exam, and it's through American Medical Technologist. Our sit rate is pretty excellent on that. I imagine that once you come to school to become a medical assistant, your strive is and your goal is to take the exam so that you will be certified. So our sit rate is at 95%, and our pass rate is at 97%. So this is excellent as well. This tells us that our students work very hard And obviously me as their instructor has a passion to make sure that they get to where they need to be. The couple of other things that I would like to mention for our students is that we have, well, I'm sorry, let me back up there just a minute. I cannot forget that I have an excellent student of mine. His name is Jacob, that is here to join us today. And what I want to do is sort of interview him and let him share with you his experience. So he's on the line with us today virtually. And Jacob, I'd like to welcome you this afternoon.
Hello. Hi, Ms.
How
Doc-
are you? How are you?
How are you?
Good, thank you, thank you. Well, Jacob, I asked you to be with us today because I'd like for you to share your experience so others can hear. And so one of the questions I have for you is if you could just share a little bit about your experience at Kaiser University as a student and what you got out of it.
Okay. Well, I'll start from the beginning.
Okay.
Give people that are interested a full scale of what it's like at Kaiser. So I was looking at different degree options to finish, and Kaiser popped up locally, and I ended up visiting the campus the next day, met with administrative. We went through the application. I got applied. I actually met you that same day. And by the following week, I believe I was already starting school. So it's a very fast process. Everyone's there to help you. They try and make everything in a one-day stop with meeting with financial aid, advisors, meeting your professor, showing you around the whole campus. It's very welcoming and nice atmosphere. I love it. The one thing that I've noticed about Kaiser from a different university that I attended is the class structure. I like that it's one class at a time. That really separates everything instead of, you know, having 4 courses all at once worrying about everything. You just have, we're just going to focus on like lab skills, and then we'll be done this month. The next month we'll go and do clinical work, and then next month we'll do radiography, which actually is an interesting class in itself because we're one of the schools that offer this program, so we can actually learn how to take x-rays, and if we choose to, we can get our license in it, which it was the BMO, I believe, right, Ms. Seibert?
Correct. Correct, yes. Mm-hmm.
So that was a cool, interesting thing, but I love the program. I just finished recently last month, and I'm going externship here soon, and then I'll be graduated and out in the healthcare field.
That's excellent. And that's something that I do want to mention is that our program, the students can come in, because that was a question, I believe, from you know, someone in the audience, was our students can come in every single month. So if somebody comes to the school and they do a tour and they feel like they're interested in medical assisting, the most they might have to wait is a couple of weeks or a few weeks before they can actually enter, because my students can come into the program monthly. It's one class, 1 month at a time, one class, one every single month, and so they can enter, you know, one every single month. And the program itself is 16 months long, and you will receive a 2-year associate's degree in medical assisting. So I shouldn't speak for you, but I know that a lot of students have said that it goes by fairly quickly. Do you feel the same way?
It does go by very quickly. That first week is just a lot of information, getting used to how KU works in itself. Each class is differently. By the 3rd week, you're like, wait, I still want to learn more. I want to do more. I want to do more practices, especially like in clinical. That was my favorite class because that's what we're going to do in the field. So learning how to do like the body positions when you take a patient back, doing patient intake, vital signs. It's very fascinating. And then also lab procedure, where we learn how to do shots, injections, and help set up the room for the physician or doctor for a procedure that might need to be done. There's a wide scope. And I like the structure of some of the classes because it kind of helps you narrow down what kind of field you want to go to as an MA, because there's so many, like how you have done in your past. You've sampled with a lot of different varieties, and I came in kind of open-minded, and I was kind of torn between cardiology or orthopedics. But after taking radiography, that really kind of sealed the deal with that's what I want to do. And we also got to visit one of the top orthopedic sites, which is right next to Kaiser.
Right.
all real life in action. And like you said, we got to see some previous Kaiser students there, which was
Yes, that's excellent. And where you're going to externship.
and where I'm going to externship.
So they're a great affiliation for us. Well, thank you very much, Jacob. Is there anything you'd like to add before we move on?
It's a very great program from the department. Leslie Havlin, who's our student services, she does mock interviews and helps set those up. And that was a part of one of our classes is she helped us build our resumes, get that approved, and they went through that. We did real live interviews with an actual employer outside of the university. And I think that really helped. And it's really going to set Kaiser apart from a different university.
Certainly, it certainly does. We definitely have that philosophy where students come first, and I think that shows, and you're showing that by saying that, right? So
Yeah.
That's awesome. That's awesome. Well, thank you. I really appreciate it, Jacob.
You're welcome.
Appreciate it. So what I would like to share with you now a little bit is about our associates in our administrative medical coding and billing, and really leading into that, what I'd like to say to you now is obviously we all know that right now we're going through a pandemic, and working in the healthcare field, it's very rewarding, but this is a time where currently facing this pandemic with the COVID-19, our medical assistants are right on the front line. They're on the front line with our doctors, our nurses, other medical assistants. They're working every day with sick patients, and they work with those sick patients in doctors' offices, urgent care centers, outpatient facilities. And that is awesome. And they are our heroes along with those doctors and other healthcare workers. And we can't thank them enough, because without them, what would we do? And this is something that if this is a field that you think you might be interested in, this is where you can see yourself. But not everybody wants to work hands-on with patients, but they still want to help people. So something like the administrative medical coding and billing is where somewhere where you might want to be. And so to tell you a little bit about administrative coding and billing, at the end of your education, you would take a certification to be licensed. You would work in hospitals, physicians' offices, nursing homes, and you could even work remotely from home to fulfill your task from home after you have a little bit of experience. Your job would consist of submitting medical claims for reimbursement, coding medical diagnoses and procedures, and operating computerized billing systems. Now, it is a very important job. You obviously have to have great interpersonal skills. You have to have integrity, and you have to pay close attention to detail. That I'm going to tell you for sure, but it is a very rewarding job. Now, that program is also an associate's degree, and it can be fulfilled within 18 months. So we offer they're both my programs. They are offered here at Kaiser University. They're two very great opportunities, two different opportunities, both help patients. One's more administrative and upfront, and one is, hands-on clinical in back. So you see that you have two very great opportunities there. And for anyone who might be out there who have family members, friends, or anyone who's working frontline for COVID-19 right now in this pandemic, I want to say kudos to you, and you're our hero. And thank you for joining us today. And now I'm going to flip it over to Leslie Haviland in Student Services.
Thanks, Lisa. And thanks, Jacob, for the shout out to Student Services. We always appreciate that. But we truly do love to do mock interviews with our students. We also prove resumes for every single student. They give us a resume before they graduate, because our goal is to ensure that all of our students are working in their field of study within 90 days of graduation. So that's what we get to do for our students, and that's a part of that student's first mission. I will say that all of our graduates in medical assisting that have completed their degree that want to work in field are all working right now. And the same goes for the medical administrative billing and coding as well. The graduates from that also are all working in field. So I know placement is one of the items that that some of our guests today have asked about. So I just want to make sure that I get that information to them. Again, most of our students get hired at externship because our valued employers love our students. They call and ask Ms. Stivers or myself and say, please send me another extern. We're looking to hire. So it's a great way for us to, to share our awesome students with the community. And I just wanted to mention a couple of our employers today. These are some of our main employers, and that includes Cleveland Clinic, Martin Health, South Florida Orthopedic, which is where I'm assuming Jacob is going to be going to do his internship. And they're right across the street from us as well. Florida Community Health Centers, as well as Treasure Coast Urgent and Primary Care Centers. So just another reminder, if you guys have any questions, please put that in the chat and we will address those. And now I'd like to turn it back over to Ron Lewis.
Thank you, Ms. Havlin. And first of all, folks, we'd like to thank you for spending time to learn about our medical assisting and medical administrative billing and coding and associate degree programs. What you've seen today is just a glimpse into the many rewarding degrees we offer here at the Port St. Lucie campus. Additionally, if you'd like more information about these or any of our programs at Kaiser University, we will gladly arrange time to have you speak with one of our admissions counselors in a one-on-one telephone career planning session. Our contact number is going to appear in the chat line there of 772-398-9990. And you can also contact me directly at my email address, which is also appearing in the chat line there at rlewis@kaiseruniversity.edu. Again, we'll set up a time that's convenient for you to speak with one of our knowledgeable counselors and discuss your career objectives and go through that particular information. Now, something for, we had a question earlier, and I want to make clear that we do have financial aid for those who qualify. We are a yellow ribbon institution recognizing the service and sacrifice given of our armed forces. And we have a variety of scholarship and individual need opportunities to help make your education affordable. Generally, you work directly with one of our financial aid counselors. They have you start by filling out your federal FAFSA, which is your free application for federal student aid. And it helps determine the items that you might be eligible for. And again, they work to package and make your education affordable. So we look forward to discussing your career goals, sharing information about our university, and exploring whether Kaiser University might be a good fit for you. Jacob obviously took that first step. He found a home in Kaiser University, and I believe Jacob will be a very successful graduate when he leaves the university. We will take some time, if you'd like at this moment, to take some additional questions. If you'd like to add those to the chat, we'll look for those. Otherwise, we would like you to have a great day and be safe out there. Thank you very much.
But I don't want to talk.
If you'd like to type those questions directly into the chat line, we'll be more than happy to answer those for you.
There's a thing here that's
Okay. I'm not seeing any questions at this time, but folks, as I mentioned, I do encourage you to reach out to us. Again, 772-398-9990. Again, email me at rlewis@kaiseruniversity.edu. We look forward to serving you. And again, thank you and have a great day.